Good morning everyone. My name's Penny Lewis. I'm the Academic Career Development Lead for the NIHR Applied Research Collaboration Greater Manchester, and it's my pleasure to invite you here today for our first ever in-person capacity building showcase. Capacity building is about strengthening the research skills and knowledge of our health and care professionals across the region, but also our researchers as well, helping them develop to be the next generation of research leaders. The purpose of today really is to share the fantastic work that our award holders have undertaken. In particular, we've had today sharing their work our interns, who have been working with us over the past year to dip their toe into research, understand a little bit about what it entails.
My name's Georgie. I'm a paediatric metabolic dietitian from Manchester University NHS Foundation Trust, and I'm just going to talk you through my ARC research internship journey, starting with why I chose to do the internship, what my objectives were, the learning opportunities I had, some achievements, reflections and next steps. Ultimately, what I really want to do is use research on a day-to-day basis to help inform dietetic practice in inherited metabolic disorders in order to improve the efficiency, quality and safety of patient care.
My overall aim, or my hope really, for the internship was to pursue my interest in research alongside my clinical work.
Why I did this internship and the positive thing, first thing and the most important one, I think, dedicated research time. Because working in NHS, it's very difficult to put some time aside to research. Everyone wants you to do it, but finding a time is very difficult.
The main aim was to enhance my existing research skills, to deepen my understanding of the research methodology, design, analytic techniques, and to build a strong foundation to pursue my career in research.
Today is about them sharing what they've achieved, going back to their practice to share what research is all about, to get them engaged, to take part in other activities that we offer. We're going to hear from our ARC GM pre-doctoral fellows.
I'm Coral, I'm a social worker, I work for Bury Council, I work in the older people's mental health team. For the last 12 months I've been working on a project around social work intervention with trans and gender diverse service users.
Admin and clerical staff actually make up around about 21% of the NHS workforce, and we know that these staff are absolutely essential, yet their experiences of psychological safety in the workplace are little explored, very under-examined.
And then we have a social care section. Dr. Caroline Lear will be sharing the work that her social care network have been working on over the past year and the projects that they've been starting to set up.
I was asked to mentor the social care research champions, which is obviously an honour and a privilege to do. They all have passion around making improvements in people's lives, and particularly improving quality of life outcomes, but in a real way, in a meaningful way.
In my day job now, I review and work with people with learning disabilities who have been placed out of the areas that they're from and areas their families and communities are. One of the things that was not happening when that happened was that the voices of family members, parents, weren't being heard. And so I've spent the last few months interviewing family members about their stories.
My research project is about exploring menopause knowledge and its workplace impact among social care staff. There's so many amazing women around me who are going in blindly a lot of the time, trying to deal with a really difficult job and the symptoms of the menopause. It's no wonder in social care we've got an issue with staff retention when we've got a predominantly female workforce.
We have got great presentations lined up for PCIE, patient and public and community involvement.
Getting involved with the ARC has made a massive difference to me. I'm now a co-applicant on 4 research bids. I've mentored the White Tag, I've wrote loads of poems, blogs, I've spoke at conferences, I've been on the radio, I've made films.
It's an absolute privilege to be part of ARC. You know, I've met so many wonderful people. For a long time I felt abandoned, and it wasn't until I came to ARC that, I was restored to the way I am now.
Our Young Persons Advisory Group are here to talk to us about the fantastic things that they have been doing.
My name is Beatrice and I'm part of the Young Person Advisory Group, aka YPAG. So again, I joined because I saw my dad do these things and I was like, oh, basically I got inspired and I joined.
I'm here to talk to you about my journey, which we are calling Lost and Found. So whilst I was kind of fumbling about trying to figure out what to do, I started volunteering for a mental health charity called Awakening Minds. Throughout my journey with ARC, with the YPAG, I've learnt what I want to do. So I have become a consultant in racial and health equity.
I'm doing events with the YPAG. I'm building my skills. I'm building my network. I'm building everything.
I got involved in My Voice Matters in Research, which was just an event to represent the voices of young people who often go unheard.
We're also going to undertake a few activities where we're going to ask our attendees to think about some of the challenges and some of the opportunities for building research capacity across health and social care. The talks have shown how they've been engaged in lots of training opportunities, conferences, networks, all manner of opportunities, and really benefited from those. But there's still more we can do.
Just a quick overview of the ARC that will be starting on the 1st of April next year. We want to foster a vibrant and inclusive research culture that produces timely, needs-driven, transformative health and care research for the benefit of the people locally and nationally.
In ARC 2, I think we're thinking forward to how we can support research capacity across the pipeline. So thinking about how we can inspire the next generation of health and care professionals much earlier on in their education, to think about research as a possible route and avenue that is accessible to them. Provide experiences for them to dip their toe in, like our internships, but perhaps other ways of having a go at research, seeing what's going on, placements, lots of different mechanisms really, so that people are exposed who perhaps traditionally aren't. And hopefully that will then inspire people to perhaps overcome that often all too common kind of thought that, oh, this opportunity is not for me, research isn't meant for me.
We've designed this ARC a little bit differently so that the people that we are involving in our research, whether they are participants or whether they are our staff, should be representative of our community. We've got research capacity development, we've got knowledge mobilisation, how do we get the products of our research out there and used, and prioritising partnerships. Partnerships is going to be a really, really important part of the next ARC, as it has been for this ARC.
Now I'm a co-author. Our paper is the use of community connectors to increase Black community involvement in research. Now they write to me, Springer, BMC, BMJ, they write to me as a publisher. If we are talking about capacity building, this is the thing.